Hello, everyone. Hello, welcome. Welcome to Beyond the Basics. This is Hallie Cloud. Beyond the Basics is a project of the Center on Budget and Policy Priorities, and it's designed to provide training and resources to facilitate enrollment in the health insurance marketplace and in Medicaid. We provide these resources for healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. The Center on Budget and Policy Priorities is a nonprofit policy organization, and it is not a part of the U.S. Department of Health and Human Services. The webinar is, this whole series actually is not intended for press purposes either. So as always, after the webinar, we'll post a video of this presentation to our website at Health Reform Beyond the Basics. .org, healthreformbeyondthebasics.org. We'll post that to the website after the presentation. We'll also post the slides and any resources we mentioned in the webinar. I'll also put a link to the slides in the chat as soon as we're done with the intro, so you'll be able to follow along in live time. Next slide, please. All participants are muted and in listen-only mode. You'll be that way for the entirety of the presentation. So if you'd like to ask a question, please click on the Q&A icon in the control panel at the bottom of your webinar screen, and you can type your question into the little box there. We'll monitor throughout and stop for questions a couple of times. We're definitely not going to be able to answer every question that is asked, but we will have a record of all of your questions, and we use them as guides for future resources and presentations. You're also welcome to email us at beyondthebasics@cbpp.org to get questions individually answered. Next slide, please. So today, in part 5 of our Open Enrollment 10 webinar series, we're going to cover strategies to help people understand how health insurance works, how to evaluate and compare marketplace plans, and then select the plans that best meet the people's needs. So today we have a very special presenter, Arianna Anaya. Ari is currently an adjunct English instructor at Norwich University in Vermont, and she previously served as a certified application counselor, community health worker, and navigator in Texas and Illinois. And so we are just so excited to have Ari here with us today, and I will turn it over to her to start the presentation. Thank you.
Okay, thank you so much. I'm so excited to be here. I cannot say enough how happy I am to be able to talk to assisters about this very complicated but very heroic work. If you are brand new to this, welcome. You will do great things. And if you've been doing it for seasons and seasons and seasons, hopefully there's something within this that is helpful and of interest. I find that I learn the most about assisting when I listen to how other assisters approach it. So hopefully there will be some things for you here. We're going to start with some tools that are available for everyone. After that, I'm going to talk about generally my approach to providing clients or enrollees with health insurance education. There's a script there, and then also some kind of asides to help you navigate the slides of healthcare.gov. I'm also going to be looking a little bit at Kentucky's state-based exchange, just so we're not totally focused on healthcare.gov, but also taking into consideration those of you who are using your own state's website. Finally, part 3 is going to talk about how to assist clients when it comes to multiple plans. So we'll talk about a couple other strategies then, and I'm going to reference some of the tools that I will make mention of early on. Okay, so each of these items is clickable. Now, how clickable it is exactly this moment, I unfortunately cannot tell you, but once the presentation is available to everybody, you should be able to open each of these items. Specifically, at the very top of the page are a bunch of tools that were created over the summer specific to the task of building basically resources individual to your entity, to your zip code or county when it comes to your market and the different plans available within that market. So the very first item under the webinar is basically a document that contains a link to every single state-based exchange's C plans calculator. And this is a tool that I highly, highly recommend if you are brand new to assisting. As soon as the end of October rolls around, this is when 2023 plans are usually going to be made available. And the C plans tool gives you the opportunity to kind of preview what this next season's market will look like. So highly recommend you take a look at that. Now, I will acknowledge that these tool links are obviously specific to 2022, and it's possible we'll need to update those once the season actually gets geared up a bit more. But that's something I can definitely ensure happens, and that link will be updated as well. Below those two items are blank documents that you can theoretically complete specific to your plans and your market. The second item is a Google spreadsheet, and there are little instructions written there just in case. Below that is a marketplace enrollment checklist one-pager. Usually when I do this presentation, I go into very, very deep detail as to those first steps that an assister kind of needs to deal with when they first submit an application and they're looking at basically the checklist of enrollment right before you get into plan selection. And instead of spending tons of time on that, we've built a one-pager that includes screenshots from healthcare.gov and kind of goes into the ins and outs of those questions, recommendations, and how to talk to clients about them generally. So my hope is that this is helpful. My bigger hope is one day we will have a full guide to every screen on the marketplace, but that might take some time. So if you have feedback or comments, I think I definitely would love to know about it. So there is an email for Beyond the Basics where any of those comments could go. Finally, I want to call your attention to the Center on Budget plan comparison worksheet. This is something built by Beyond the Basics. And while I'm always going to tout how useful building specific templates and plan comparison tools are, this is such a useful tool to kind of help a client focus specifically on their plan options. I'll talk a little bit about that later on. And then finally, the next slide is going to be the 2023 FPL chart that is built a specific way. And it's built this way in order to call attention to the cost sharing reduction brackets. So essentially, we will get into talking about actuary value just a little bit more later on. But why I build the chart to look like this is to ensure that assisters are using this when it comes to helping a client who's uncertain as to their income, because someone who's at 150% of the federal poverty level versus 151% is theoretically eligible for a different level of what's called cost sharing reductions in silver level plans. And I'm going to provide y'all with examples of this later on. But if this chart is of use to you, please feel free to use it. The image is on this slide. And when you guys have access to these slides, you can just take a screenshot, etc., whatever works. I will let you guys know that I'm going to be pulling from the 2022 FPL chart. So essentially the federal poverty levels that we're relying on right now, because of the fact that I unfortunately can't show you guys 2023 information until we're in the 2023 enrollment season. So always kind of the challenge, I think, of doing these trainings in the lead up to open enrollment is we only really get hold of the plans right as open enrollment begins. And that, of course, is kind of a busy time for training. So I want to make sure it's clear that what I'm talking about today has to focus on 2022, right? But of course, for the most part, looking at the past, I think helps us prepare for the future. So I will be relying on this data set, but know that the 2023 chart and information exists. Okay. So we're going to start by talking about providing health insurance plan education. And again, this is sort of going to be my recommended approach and sort of what is hopefully a straightforward and useful script. So this is the enrollment checklist that says Beyond the Basics resource pending. It exists. I shouldn't have said that was pending. But that's one of those items listed on the tools page earlier. And I'm going to go kind of quickly through it because the resource has much more detail. But briefly, once you have actually submitted a marketplace application or a state-based exchange application, depending on where you are, open the eligibility letter and then proceed to enrollment, there tends to be this sort of checklist. It's almost a little application in and of itself. So I briefly wanted to talk about how to answer these questions. And again, the resource goes into this in much further detail and is built so you can have it alongside you as you're walking clients through this the first couple of times you do it. But the first question you will get is how much of the financial assistance, the premium tax credit, the client wants to use. And what I recommend here is not spending a ton of time on that first step because of the fact that most assisters ideally spent time with the client when it came to the income estimate. It's a good time to remind the client that their income estimate can be adjusted any time of year if it should change, but trying to jury rig the financial help they're going to get based on unknown factors doesn't tend to lead to the best results. So my sort of summation of how I ask about this screen is, you're eligible for this much financial assistance. Most people use it all in order to afford the insurance. Would you like to use all of it? And the answer is usually yes. Second question or step is going to be about tobacco use. You can be very literal about tobacco as a kind of content of this usage. And briefly, I've written out the legal definition, which healthcare.gov does have once you're actually at this question. This is within the past 6 months, 4 or more times per week, excluding religious or ceremonial uses. But if we're talking to someone who is a vape user, the question becomes, is there actual tobacco in the ingredients? So for example, chewing tobacco counts as tobacco use. But if somebody is vaping a non-tobacco item, that's not considered tobacco use at this time. So the next step, step 3, I want to call attention to because I witness a lot of assisters painstakingly entering all the client's doctors, hospitals, and medications. I would avoid doing that. And the reason is that, firstly, if you do enter tons of prescriptions here, you still will need to look up the individual cost of those medications specific to each plan. So it's not necessarily helpful to gather this information here. Now, when it comes to doctors and facilities, sometimes this works well, and sometimes it doesn't. And the reason is that the marketplace is pulling data from the website of the provider, and sometimes it simply works better than others. And my advice there is that a tool that sometimes works is usually not a great tool because you won't know when it's working or how well it's working. So sometimes as a mode of immediate elimination, it can be helpful, but my advice is spend less time here and more time with the plan and company's provider directory and formulary, which is where you would look up how the drugs are tiered to tell the client what they would cost with each plan. So we're going to spend the bulk of today on step 4, which is about choosing a health plan and how to help a client with this step. I'll get more, of course, into this step in just a moment, but I also want to let you guys know that if you go to look at plans, right, you've gotten through some of these steps and you're actually seeing plans, and then you learn that one member of the household, let's say, has higher medical needs than the other and needs to be in a more expensive or a separate plan, you would actually want to return to the checklist and go back into the choose health plan step 4. This is where the grouping option is hidden. And I'll add that healthcare.gov tends to group members of the household in as simplified a manner as possible, right? Most people, husband, wife, and children under the age of 26, it will be grouped on the same plan. But if, for example, wife has higher medical needs or needs to be for whatever reason in a separate plan, you could change that. You could have husband and 2 kids on one plan and wife on a separate plan. It is very hard to remember that this is where this ability is hidden. So I recommend know that this is an option and touch base with someone at your entity if you forget exactly where it is. Or, of course, you can check with the one pager that is going to be linked to this presentation. Next step is going to be the dental enrollment step. And I have always found that dental insurance, for whatever reason, is something that clients are super excited about. But I find that clients should probably not randomly make a dental insurance decision. Dental insurance is obviously helpful in terms of cost if you know exactly what your dental needs are. Most clients do not. And what tends to happen is they pick a dental plan randomly, pay for it all year, and then when an actual dental need comes up, they find that the specific tooth, the specific filling, or the specific dentist that they want or need to see isn't going to work with this dental plan. So what I tend to advise clients when I get to this step is dental is actually something you can purchase when you need it, specific to the need. There is no reason to pick a dental plan now because you can buy it year-round directly from dental companies. Finally, the last step is confirming your plan choices and enrolling. This is obviously pretty straightforward, but I wanted to call quick attention to this optional option. For the most part, I think this part can be very confusing. You click it and it asks you to say, does the client expect to have high, medium, or low use of health insurance, which to my mind is just a conundrum. What does this mean? How do you know if your notion of low use is the same as this person you've just sat down with? But what I want to advise is if you indicate high as a practice, every plan you look at once you get to the choose plan step will show up with the quote unquote worst case scenario calculated automatically, which can be very helpful when you're comparing plan options. So this is something that can be skipped. I would not use it to indicate low or medium, as I think those are kind of subjective, meaningless terms. But again, if you use this consistently and click high, it can be part of your assisting strategy. Okay, so I have a couple of thoughts and feelings, generally speaking, about providing health insurance education. And I think the most important one to my mind, I'm an educator for a long time. And it strikes me that the more in-depth I get into knowing things, in theory, the less helpful I am as an educator, because my expertise is going to negate the learner. And I find now that I'm teaching at a military school, I don't understand any of the acronyms that these kids are using. I don't know anything about it. And so I realize sometimes that when I'm explaining health insurance, I lapse into using acronyms or jargon that my client may not be familiar with. So I always want to encourage and remind people, when you are learning this stuff, you are probably the best teacher of it. And coming at this as kind of an investigator, someone who's trying to figure this out with the client, tends to be the best way to go. And I've done this for a number of years. I've witnessed all types doing it. But I do want to just reiterate, don't try to be an expert. Try to be someone who is, as our title kind of expects, someone who's helping, who's assisting with this challenge that is health insurance. I also want to really recommend that you do not start explaining health insurance, how it works or what the terms mean, until you are at the plan selection stage. I have sat down with maybe hundreds of clients who are like, so what's a deductible? Before we've even touched the application. I would ask that client to hold off until we're at the plans, because nothing is worse than trying to learn about health insurance theoretically. Nothing is more boring, and nothing, I would say, is going to stick with a client less. If you are actually looking at plans when you provide this education, you have a higher chance of them understanding it, and you will have a literal visual aid in the form of the plans being in front of you. So I highly recommend nicely letting the client know if the first words out of their mouth is, I only want a PPO or something like that. Let's get through the application and we'll talk about the plans once we're there. Okay, so you've gone through those steps previously, you completed an application, submitted it, saw the eligibility letter, and you're now looking at plans with your client. So what I tend to do is I start by letting them know the total number of plans available. So this is an option on healthcare.gov. Some of the state-based exchanges list this very prominently. Some it's a little bit more hidden. So of course you want to adjust this to whatever your shopping tool looks like. But this, I want to say, is a screenshot of plans available to people in Chicago, Illinois. And you can see that I've indicated where the plan count is. So my opening sort of explanation would be, you have 137 plan options available from 7 different companies. The plans are in order of the monthly cost, okay? And the biggest difference between all these 137 plans is where you can go and the cost. And this is kind of a balancing act of what you pay for the health insurance, but what you pay for care as well, which has a teeter-totter type relationship. Now, where I get that 7 different companies is going to be in the filter button, which is right above that plans button. So I have to immediately call attention to how amazing I think the filter button is. It will give you information right off the bat that otherwise scrolling through plan after plan after plan will not really synthesize for you. So y'all can see right off the bat, it tells me I can count that there's 7 health insurance companies, but it's also helpful that right off the bat, I know what companies are available to this client in case they said something right at the start, like, hey, I had Ambetter last year, I want Ambetter again. Okay, great, Ambetter's still here, right? I can set expectations with this screen rather than having to scroll, right? And disappoint them while I look. So just to reiterate, cannot stress enough how helpful I find this filter tool. And I've zoomed into it a little bit just to show you guys how much information is available right if you pull that open. I know the 2 plan types available to a potential Chicago enrollee. I know there are only HMOs and PPOs. Even better, I can see that there are quite a few HMOs and not as many PPOs, which might be helpful for expectation setting, depending on what the client's needs are. Likewise, I can see the companies that are available to this client. Okay, so cannot stress this enough, specifically if you assist people who are all over the state and may have different options. This can be a wonderful place to start in terms of orienting yourself and briefly orienting the client before you get into talking about the plans. I wanted to pull up Kentucky state-based exchange. I'm probably gonna, is it KYNECT? KNECT. Okay, I'm probably butchering that and I know you guys can't help me, apologies. But the filter tool has very similar data points available. So you can see there's that insurance company and plan type. So one difference with Kentucky's is it actually lists every single plan type in existence, including indemnity, which is not available. So what I wanted to call your attention to is in trying to help someone navigate the Kentucky market, and I want to say I was looking at Jefferson County, what I did was I actually used the filter tool to search each of them. So I looked at PPOs, HMOs, POSs, EPOs, and indemnity plans. And for every single plan type except HMO, I got this screen. So this is a little bit more onerous, but I think what's important is the information is available. So you can take a beat and basically say, okay, just so you know, the plans available in Kentucky in your area are HMOs. Okay, so that kind of a little more work, but the information is there. And happily, much like the healthcare.gov plan insurance company read, it doesn't list every single health insurance company in existence. It only lists the one in this area. So it gives you, again, 4 companies, right? They're HMOs. Okay. So pivoting back to continuing this plan education, I've already let them know that plans are organized by monthly cost. Now I let them know that they're also categorized by the metal level. There are bronze, silver, and gold plans. If your market has platinum, mention platinum. I sometimes say, just like the medals in the Olympics, but honestly, I don't know how often people watch the Olympics anymore. So this may not be very useful. What I tend to give them an overview of is that bronze plans usually have the lowest cost, but higher care costs, whereas gold plans tend to be more expensive, but care costs less. Now, I'm speaking generally, of course, because depending on their income, a silver plan might have a lower cost and a lower care cost than gold, but it's okay to provide them with sort of a general illustration of this as you talk about the categories. I like to let them know of the balancing act, right? And I think that's a good way to help clients understand health insurance as a kind of act in balance. Very hard, I find, to get every single thing you want ever, but particularly when it comes to health insurance. And so setting them up to understand the kind of give and take of this cost factor can be very helpful. What I tell them pretty consistently is that I will start with a silver plan. If there are multiple silver plans, I let them know I will start with the classic silver plan to give them an overview of how health insurance works. I'll explain that a little more in just a moment. So briefly, I wanted to talk about these categories, these medal level, Olympic, whatever they are things. I want to be very clear that actuary value is something I very rarely explain to clients. And the reason is that it is largely theoretical. The idea here is bronze, silver, gold, platinum are essentially calculated. The value is calculated connected to the deductible, the out-of-pocket max, to essentially look at in a given year for someone whose costs hit a certain amount. The bronze plan will have about 60% paid by the insurance, with the client paying the remaining 30. The silver will have about 70 covered by the health insurance. The client pays the remaining 30%. I think I said 30 for bronze. I apologize. I can't do math. 80 for gold. So the insurance is covering about 80 costs in a given year. Client pays about 20. Now, why this is theoretical is that obviously someone's actual medical costs can kind of majorly throw this theoretical chart out of whack, right? When I was 17 years old, my kidney exploded. My healthcare costs wound up being something to the tune of $550,000. I had something like a $9,000 deductible. But as you can imagine, I had a high deductible bronze plan. If I did the math, I did not wind up paying 40% of the cost of my care. The insurance company largely ate the costs of that incident. So this calculation, again, very, very much won't necessarily help a client with anything beyond the understanding of, as costs for the monthly premium tend to go down, costs for care tend to go up. So I would not spend too much time with the actuary value beyond them understanding the logic. Quickly, I'm going to pivot to talking about cost sharing reductions, because that also throws the notion of the actuary value slightly out of whack for those who are between 100 to 250% of the federal poverty level. So the way this chart works is, if you're looking at the column on the far left-hand side, a household of one is at 100% of the federal poverty level for 2022 at $12,880. They are at 250% of the federal poverty level at $32,200. Basically, if they're within that income range, they're eligible with a silver plan to see an additional reduction in their deductible, out-of-pocket max, and sometimes their copays, depending on where you are. So it's important when you give this explanation that if they're eligible for that additional help, you let them know that in a silver plan, they're going to be eligible for additional assistance with the costs of care. And I wanted to quickly illustrate what this looks like with one plan. And what you guys need to be aware of is if you are showing a client plans, they will not see the plans that they will not see the original deductible out-of-pocket max. They will see it with the reduction. So just quickly, if I have someone earning $40,000 a year, so they're above eligibility for cost sharing reduction. So their silver plan will have sort of the base deductible out-of-pocket max and copays, which you guys can see right here. However, if I'm working with someone at $20,000, you guys can see they're in that kind of second range of cost sharing reductions. Instead of an $8,100 deductible, they're looking at a $0 deductible. Instead of an out-of-pocket max of nearly $9,000, they're looking at an out-of-pocket max of $3,000. And you can see the copays too are lower. Now, they're never going to see those cost sharing rates associated with the $40,000 plan. Healthcare.gov and state-based exchanges will show you the plans at the appropriate silver rate. So that source of comparison is only something we kind of see and know behind the scenes. But I think it's also important to be aware of these brackets, because if someone's estimating income and for whatever reason they estimate $1 over 150%, it can massively change their eligibility for different cost sharing. So this makes those brackets helpful. Okay, so back to plan education. So firstly, you guys can see my little explanation of how to describe the monthly premium. I'm careful to make sure they understand you have to pay this every month, regardless of whether or not you use your plan. Make sure if there's more than one person grouped on the plan, you tell them that the monthly premium they're looking at is for both parties, because people sometimes get confused. I also wanted to harken back to my classic cost sharing structure. And what we're looking at when we pick a plan to describe, and again, I call it classic structure, is a deductible that's different than the out-of-pocket max, a plan that shows at least one copay for care and one coinsurance, so that you can explain all things with one plan. And then as you talk about other plans, compare it to the function of the first plan. You're also simultaneously giving them an explanation of the marketplace's layout, which is very helpful to them. Okay, so we talked about the monthly premium. The deductible is explained here. So this is essentially what you usually have to pay prior to the insurance paying their part. So the deductible is where people get upset. And again, if you're looking at someone in that 100 to 250, their deductible might be a little bit more reasonable, but they still might get upset. And the general reaction, I think, is who is going to pay $8,000? I am healthy. I don't plan on getting sick. I don't need health insurance. Now watch how my little thinking dude with his hand on his head is going to change. See that? Now he's holding a massive bill. The ACA has massively helped the rates of bankruptcy in the United States caused by medical debt, but it still remains one of the biggest reasons that Americans declare bankruptcy. What I tried to do was list out some of the without insurance cost of certain things. And you guys can see nobody plans to have an appendectomy, right? That's a down payment on a house. Like that's a car. Sometimes giving clients context for how much medical care costs can be helpful because they simply may not know. Okay. Something else to say quickly about the deductibles. Healthcare.gov, and I want to say most of the state exchange, no, not all of them, but some of the state exchanges will show you a deductible and out-of-pocket max for the family total if there's more than one person being enrolled on that plan. This is not helpful because it's an even scarier number. So what you want to do is click on that plan details key, and it'll pull up a bit more of a detailed breakdown. And you can see there's a space for the individual as well as the family total. And so the cheat sheet here is if you're enrolling 2 people on one plan, each of them have a deductible and out-of-pocket max as listed here. For the most part, okay, the family deductible is not going to come into play if you're enrolling just 2 people on a plan. Both of them have an individual deductible. Both of them have an individual out-of-pocket max. They each need to meet those for the respective benefits to kick in. The only time a family deductible will come into play is if you have 3 members of a household on one plan and 2 of the 3 hit their deductible. At that point, as you guys can see, because the family deductible is double the individual deductible, if the family deductibles hit, person number 3 has hit their family deductible. Okay, so this is an unusual situation where 2 of 3 members of a household will have medical needs that high, where the third person is going to benefit, quote unquote. So be aware the family deductible is less relevant than I think sometimes clients suspect it to be. Okay, so going back to plan education, I like to ensure that clients understand, yes, the deductible is sometimes very high, but there are certain services that may be covered just by a copay. So with this plan, we can see primary care visits have copay of $45, specialty have $100 copay, and generic medications have a $23 copay. And I'm specific about the fact that with those specific items, you do not have to first worry about the deductible. Healthcare.gov usually does a good job at stating when a copay is pre or post deductible, but you can always double check by pulling open the summary of benefits. I let them know that coinsurance is going to be the other way, that a health insurance company splits costs with them. So here we can see that there's a coinsurance of 50% for an emergency room visit. So you're on the hook for the deductible, and then 50% once that deductible has been met. And this is where I will do a little math with them. This also gives me an opportunity to illustrate the sometimes expense of medical care. So if the ER visit is $20,000, okay, the client's on the hook for the first $8,100, the deductible, and then they have a 15% coinsurance of the remaining costs. So $20,000 minus $8,100 puts us at $11,900. Half of that is $5,950. So based on the logic of this part of the plan, the client would be on the hook for $1,450, except for the out-of-pocket max. This means if you've hit your deductible, which simultaneously contributes to the out-of-pocket max, they're like a meter that can fill up simultaneously, you have met your worst case scenario for the year. The health insurance company must pay all costs above this amount, right? This is the end of your contributions, as long as you are availing yourself of covered services and in-network services. You guys can see I have some caveats listed at the bottom that it's good to appraise clients of. I end on the out-of-pocket max because I think it's kind of a way of ending on a good note or a better note, right? This is a protection for them. Okay. I think my clients are perhaps cheeky with me, but I think clients are also cheeky generally. They like to throw things at us. Well, what will this cost? Well, what will that cost? Don't delve into these things with them unless they have a specific item that you can look up in the summary of benefits. Reiterate the logic of this. You are responsible for paying your monthly premium, paying applicable copays for those services. If you have services that are not covered by a set copay, you're going to pay for those until you've met your plan deductible. Then theoretically, you start paying co-insurance until you've met your out-of-pocket max. All right. Once you meet your max, you're done. The health insurance company is on the hook 100% for all in-network covered services. Quick caveat for the PPOs. My market in Texas didn't have any PPOs, but many markets do. Be aware, people are always very excited about the idea of a PPO because it means you can go out of network. It is never going to be financially advantageous to go out of network. All right. I don't like to make absolute statements when it comes to health insurance, but I have yet to see a plan where going out of network is an affordable option. So you can see I've pulled one random PPO. I want to say this is another Illinois plan. You guys can see the out-of-network deductible is $15,000. So you will pay all out-of-network care costs up to $15,000. It's a separate deductible from your regular deductible. And then you're going to pay 50% of the cost of seeing any other out-of-network doctor up until the entire year because there is no out-of-pocket max for out-of-network care. So while yes, a PPO offers this flexibility, make sure clients understand that the out-of-network care costs can be quite extreme and essentially are separate from the in-network care costs. So just to reiterate, if you need to go deeper into what plans cover, you want to pull open this plan details piece. There's something very similar that I've seen on state-based exchanges. So it tends to give a bit more of a summary, but if you keep scrolling, you will see something that says plan documents. Pulling open plan documents will give you access to the summary of benefits, which goes into a little bit more specific detail about the plan's coverage. It also has the provider directory and the medication lookup tool or document. So looking at the Kentucky state-based exchange, it's similar. It's not exactly the same, but if you click on the actual plan, and luckily it looks like a link, it will take you to an additional page that again links you to these items. So sometimes you need to go a little deeper to get this additional information when it comes to actually helping the client select a plan. Okay, so we've provided our plan education, hopefully using a Silver Classic plan. And at this point, we need to talk about plans connected to other plans. As I said earlier, I think just talking about health insurance theoretically is not helpful to most clients. And I, at this point, recommend all plans have things in common. In fact, this is one of the beauties of the Affordable Care Act. It simplified what individuals had to consider when it came to shopping for a plan. So just a reminder, and I know Sarah mentioned this at the plan design webinar, all plans have to cover certain things. I have clients ask constantly, what's the plan that covers cancer or HIV medication? They all do. They can't just opt out of something so medically necessary, okay? Tends to be a standard when it comes to plans in a given state. Some states have a little bit more in terms of, I think Washington state does acupuncture. Texas state does not cover acupuncture, but these tend to be standardized in terms of what's available, all right? So the 10 essential benefits I'm going to pivot to right now quickly are very, very helpful. You can pull this up on healthcare.gov. What are the 10 essential benefits that all plans have to cover? I want to quickly make a mention of mental health parity because this is something that as I spend more and more time with plans, I'm seeing that health insurance companies may not be living up to mental health parity law. And I would love it if the sisters on the ground floor kept an eye out for this, okay? Mental health parity briefly requires that health insurance companies do not bill substantially differently for mental health outpatient services than they do for things like primary and specialty services. So if you guys are noticing, wait a second, there's a copay for primary visits and specialty visits but a very high coinsurance for mental health care for outpatient visits. This is something I want to ask you to call leadership in your state's attention to. Okay. All right. Given these guarantees, clients have a highly simplified situation when it comes to what they need to think about shopping wise. First item is going to be where you can use the plan. Second item is going to be cost. Now, I put these in this order because of my usual approach. You can say network, but you don't have to, right? Where you can use the plan most affordably versus cost being a balancing act, a teeter-totter between the monthly premium and the cost of care. So quickly, I'm always going to advise y'all to build tools, right? To have this information in some way, shape, or form so you're not totally reliant on the shopping tool. And so again, you should be able to view 2023 plans towards the end of October, usually the very last week, which is a bit of a crunch. But I just wanted to reiterate that you can look at these plans and start to get a sense of some of these things, all right? And again, we have these tools available so you can build your own network cheat sheet if you are interested. There's one linked at the bottom. So to do so, what you usually are going to need to do is to take a look at the provider directory. So what doctors a person can see specific to each plan. You'll see I'm doing this here again for Illinois. And what I did was I actually used the Blue Cross Blue Shield provider directory and just looked up hospitals. So if you guys look a little further down this page, you can see, and I used to live in Illinois, but I haven't lived in Illinois in quite some time. So I couldn't actually remember the two main hospitals. You guys, I'm sure, will have a better sense of which hospitals are the big important hospitals in your state. So you can see that I've located Memorial Medical Center, St. John's Hospital, and that some of the other things listed are not necessarily what I'm looking for, such as freestanding dialysis centers. And I've added that to my little network cheat sheet, and I've made a notation that this Blue Cross Blue Shield plan is a network with both of them. This is actually my fuller network overview for this specific area of Illinois. So you can see I went as far as to look up different urgent care centers and even pharmacies. So what this means is if I have a client trying to choose between Blue Cross Blue Shield and, let's say, Health Alliance, these are two different plan options. Maybe one of them says I need prompt care as my urgent care. Okay, Health Alliance would be the better option for this client. Maybe they must have CVS as a pharmacy. Again, you can see that CVS is covered by both of them, but for Blue Cross Blue Shield, it's a non-preferred pharmacy, which might mean the scripts are a little more expensive. For Health Alliance, there isn't a two-tiered pharmacy system. Maybe your client needs to have Memorial Physician Services as an urgent care facility. Then Blue Cross Blue Shield might be the better way to go. So the idea here is it can help you narrow down the companies to consider if you have a cheat sheet of this nature. I shouldn't say cheat sheet, I should say network overview chart. I wanted to also just kind of give some loose definitions of the different plan types. So I've listed these out, what an HMO is versus an EPO versus a POS versus a PPO. What I want to be very clear about is these are not hard and fast definitions. In my state of Texas, where I came from, there were tons of HMOs that did not require a PCP or a referral. So this is sometimes information that can be very useful to add to your overview. Likewise, don't explain plan types that your market doesn't have. I once overheard an assister explain each of these categories in detail, and the client was like, great, I have a PPO. And then she looked, there wasn't a PPO in the market. That's a disappointing thing and perhaps not the best use of time. So if your market only has POSs and HMOs, explain what an HMO is versus a POS. Don't explain all four if they aren't things that the client has available to them. Okay, Quickly, I wanted to show you guys my overview of the Austin, Texas market. What you guys can see on the left-hand side is plan types, but I've also included a column for whether or not a referral for a specialist visit is needed. I've done this because some of these HMOs don't require it. The usual definition of an HMO is you need a PCP and you need a referral to see a specialist. But if you guys are looking down at Bright or Moda, yes, those are two no, just Bright. Bright is an HMO that does not require a referral. So this gives that information in one space where we can talk comparatively about the company options. Likewise, far right-hand side, the different hospitals are laid out. So if a client has a specific hospital need, we can start to narrow down what companies to look at. Okay. This is even more info that you can put together, but this is what I would term a nice to have. I started to look up items like urgent care centers, imaging, labs, and pharmacies to see if this could help a client with narrowing down where they want to use the plan. And from there, picking a specific company. So again, this format is available to all of you blank. So you can use this if you wish. But also, it doesn't have to be this detailed, depending on your market, depending on your plan options. So once you have theoretically narrowed down the companies that a client wants to consider, it's important to realize that certain companies will offer multiple plan options in one metal level, which can be a little bit tricky. And what I want to emphasize here is that ultimately, all other things being equal, if a client has a full-on emergency, they are protected. If their care costs wind up being crazy high, the out-of-pocket max will protect them. However, when it comes to this deductible versus that deductible, this is really a preference thing. Some people want the lowest possible deductible. Other people want to have a out-of-pocket max that's lower and co-pays for certain services, and they don't even look at the deductible. There's really no wrong answer, though clients will try and get you to tell them what to do. So to give an example of this, I'm pulling a Bright company, 3 of the Bright plans offered in Austin, Texas. So you guys can see there are 3 different monthly premiums with slightly different deductibles and out-of-pocket maxes. What you can see at the bottom, the estimated total yearly costs. Remember when initially I told you guys to check that optional estimate your annual costs or whatever strange checklist question? Do you guys see how close each of those numbers are? So obviously, this would make a difference up front, but let's say somebody winds up in the hospital with $500,000 worth of bills like 17-year-old me did. You can see that the difference in terms of that final ultimate cost is kind of negligible, right? Ultimately, the out-of-pocket max protects you. Now, what you would want to take a look at is what is the distinction when it comes to care costs? And you can see as an example that first plan option, which is a little bit less expensive each month, $6 less than the middle option, doesn't have a copay for a specialist visit, whereas the middle option does. If that's worth to the client paying an additional $6 a month, they should do it, right? But if they're trying to go with the absolute least expensive option, they can do that too. So I think the trick is clients sometimes get very hung up on the idea that there's a quote unquote right plan. And obviously there might be a better plan, yes, but that's all going to come down to what they know about their needs and the specificity of that balance between cost for care and cost for the plan. Finally, you guys can see this hideous thing. This is going even a little bit deeper when it comes to building a tool. This format is also available. And in theory, you can build yourself a template through which to have all the plans, all the silver plans, for example, or all the gold plans in one place, so that you could look at those things alongside each other, because sometimes it's a little hard to do using just the shopping tool. Again, if this is of interest of you, I put this together using the C Plans tool connected to the marketplace. And again, there's a webinar on how to do that linked at the beginning of this presentation. Here's another one, and I wanted to call y'all's attention to, again, we have this situation where you can see I've listed the mental health costs, and we can see that here they all line up with the primary care costs, which is wonderful. So this suggests to me that all of these plans are kind of good when it comes to mental health parity law. So this is sometimes one of the best things about building these types of resources. I was building a resource like this for one market, and we saw repeatedly that mental health visits were covered with a coinsurance and not a copay. So we actually reported this to the state's Department of Insurance so they could take a look and see, is this specific plan type meeting the parity law requirements, which is really wonderful, because without the overviews that you guys do with clients, sometimes the stuff gets very lost in the sauce. So pivoting briefly to Kentucky, I wanted to call attention to how the compare tool looks here. Looks a little bit different, but again, it will list out the monthly cost of the 3 different plans. So CareSource, you can see a company offered in Kentucky, you can see 3 different monthly premiums. So if you scroll, keep scrolling, you will get to this summary menu. Click that plus button, and you will be able to look at services comparatively. So we can see with that first option, copays for in-network PCPs are 30, 25, and 25 for the latter 2. Specialist, we can see 70, 60, 60, okay? So in theory, this can inform the conversation you're having with the client when it comes to balancing the monthly cost with the cost of care. Again, always a good idea to confirm this information against the summary of benefits, and how reliable your specific marketplace's shopping tool is compared to the company's information. I also wanted to show you guys how, if building a plan overview template is not doable, and it's perfectly understandable that would not be. It is a lot of work. And if you're on your own in a site, you will not have time, right? But one thing that you can do for an individual client is to use Beyond the Basics Center on Budgets plan comparison worksheet. And I think my version is labeled marketplace, but of course this can be your marketplace. It doesn't have to be a healthcare.gov comparison tool. And when I first saw this sheet, I was like, oh, it looks like a homework assignment that I don't want to do. But what I learned about it and what I've used it for myself is I only fill out what I need. I don't need to fill out every single thing. What I'm doing is I'm taking the meaningful information out of the web space that a client may not be comfortable with, and that will change anytime I click something else. And I'm placing it in one place where the client can potentially consider it thoughtfully. So as we were looking at these different plans, scrolling and moving, you kind of forget, right? This is not the easiest thing to remember, but I find this worksheet to be very helpful in kind of essentially building a little quote unquote cheat sheet or overview for the client. Very, very helpful. A little pitch for that, They have it in all different languages. It's fillable, meaning you can write on it online, but it is also something you can print out and write in. Very useful. You don't have to fill out everything. This doesn't have to be a scavenger hunt. You only need to fill out what the client needs or what you're discussing, what you're comparing. Again, cannot reiterate this enough. If the client's going to get theoretical about medical needs, do not engage with this discussion. I've had clients try and quiz me on any potential medical thing under the sun. Pivot back to the logic of the plan and remember that that optional last place estimated yearly cost piece exists. So you can always, in theory, on the marketplace, show them that, hey, worst case scenario is listed here. I may have nearly taken us to time. I apologize for that.
That is fine. And for anyone who needs to jump off right at the hour, we are recording this, and we're going to post it to our website at healthreformbeyondthebasics.org. It should be up tomorrow, and we'll also send it out via email next Wednesday. I'm just going to ask a couple of questions. So if people want to hang out for just a couple minutes, but we'll make it short. And again, you can always email questions to beyondthebasics@cbbp.org as well. So I did want to ask a quick question about the plans grouping people together. When you were talking about grouping, if you have a family and they're grouped together, will the application and marketplace, will it group people? If there are two people in a family, will it group them in separate plans, or do they always need to be in the same plan?
Strangely, it's going to actually depend on the familial relationship. And the way I would think about it is that this website was kind of designed by, let's say, Silicon Valley types. Their notion of a family is specific. It's mom, dad, and kids. Those individuals are eligible to be on the same plan together. And traditionally, the marketplace will automatically group together married individuals and kids under the age of 26. So it will auto group all those individuals together, usually, unless you tell it to do something different. Now, if that same family also has two adult dependents, so we got mom, dad, let's say two kids, and grandpa, grandma, who are tax dependents of the mom, grandma and grandpa can be on a plan together because they're married adults. But otherwise, adults cannot be on the same plan together except where they're married. Okay. So it'll auto group grandma and grandpa on a separate group. Okay. They can pick the same plan as mom, dad, and kids, but they can't be on the same plan together. I hope that answers the question.
Yes, thank you. And then one other question. Is it common for insurance companies to allow out-of-network exceptions if no in-network specialist can be found?
Man, I could write a book to answer this question, but I won't. I would say the answer is going to depend on the persistence of the client. Okay. And this is unfortunate because so many of our clients have been schooled to listen to experts, and health insurance companies and doctors sometimes are presented as experts. I would say that if you can advocate for someone in this situation, it has a higher likelihood of seeing some success. But I would recommend, if you are seeing this, if a client is coming back to you and saying, I don't have a specialist within an 85-mile area, and you can confirm that looking at the provider directory, et cetera, this is something that you would want to escalate. So I would recommend that you firstly turn to leadership in your state connected to policy, because they sometimes can pull at levers that aren't necessarily available to the average consumer. But also, doing a complaint with your state's insurance department can be helpful. My recommendation is the biggest deal here is their adequacy requirements connected to network, which can sometimes invalidate a client saying, I can't find an in-network specialist, because it can be pretty far away. But if this is actually a situation and we can prove it, there are steps that can be taken, but it takes time. It's not easy. Sometimes, though, calling a nurse's line, every plan has a nurse's line, right? Getting that person to authorize something because they're a representative of the insurance company can be a workaround, but usually that's only going to work for urgent situations. So I would say it's generally going to be a process, but it shouldn't mean that the client gets left holding the bag. There should be steps that can be taken, but it kind of needs to be elevated as soon as possible. I would say you want to confirm that what the client is telling you is accurate, because unfortunately, sometimes clients are complaining about a preference or it seems too far away, and that doesn't work. It needs to be connected to the legal definition of adequacy. But if in fact it meets all those things, you want to escalate this with your state leadership.
Awesome, thank you. And then we're going to do just one one more question that just came in. So just to kind of reiterate, because this can get really confusing, if there are only two people on a plan, does that mean that they both have to meet a separate deductible in order for payment from the insurance company, or does it work differently?
They each have to meet their own deductible. So let's say myself and my husband are enrolled together on one plan, and I am in an accident and I hit my, why am I putting myself in an accident? And I hit my deductible. Okay. I've hit it. And those funds go to my individual out of pocket max. My husband, though, still has his own deductible to meet. Does that answer the question? So it's almost as though each of us are on sort of separate measurements when the insurance is concerned. Okay. I have my own situation. He has his own situation. He has to meet his deductible. I have to meet my individual deductible.
Yes, thank you.
For sure.
And I think since we're like 5 minutes past, I know you guys have lots of good questions. Please, again, you can email them to beyondthebasics@cbpp.org. We can answer them individually. And we'll also have a record so we can incorporate some of the stuff into future webinars and tools and things like that. So I'm going to bring this to a close. As a reminder, again, we are recording today's webinar. We're going to post it on our website. It should be up tomorrow, and then we'll send it out via email next Wednesday. We really, really appreciate you all taking the time to be here today, and a huge thank you to Ari, who's now done quite a few of these for us. And we're really excited to have her, and please use these resources. It makes a world of difference. I know there were a lot of resources mentioned in this webinar. There's links in the chat, but they'll also be, we'll link everything with the webinar recording on our website, and the slides will also be posted to the website, so you can link to them that way as well. I think that is everything. So again, if you have questions, please email us at beyondthebasics@cbpp.org. And with that, I'm going to bring this webinar to a close. And thank you so much again, everyone, for being here. And we hope to see you next week. We have another 2 webinars. You can go to our website and go to upcoming webinars to register for those. One on Tuesday, one on Thursday. So thank you so much. All right, bye.
Thank you all.